Alrighty, so it looks like a few people joined, so we're just going to go ahead and get started as more people join us in tonight's update. So hello, everyone. Thank you for joining us tonight. My name is Stephanie. I'm the Communication Specialist at the Yakima Health District. Hola a todos, muchas gracias por acompañarnos hoy en nuestra actualización de COVID-19. Tendremos nuestra actualización en español, va a ser después de esta actualización en inglés a las 6:30 aquí en vivo en Facebook. Acompáñenos ahí entonces. So recently, we've been seeing an increase in COVID-19 cases and hospitalizations in Yakima County, and the Yakima Health District is urging individuals to take recommended precautions to stay safe. This evening, we will have Dr. Yasmin Barrios, epidemiologist, and Melissa Sixberry, Director of Disease Control, to talk more about COVID-19 trends, the Delta variant, and these new recommendations. If you have any questions about COVID-19, the vaccines, please make sure to leave them in the comment section as I will be monitoring it on Facebook. And if you have any questions outside of these topics, you're more than welcome to leave them in the comments and they will be addressed at a later time. So before we turn to our guests, I wanted to give a brief summary of vaccinations here in Yakima County. As of August 7th, of individuals 12 years and older in Yakima County, 59.1% have initiated vaccination and 52.0% have been fully vaccinated. And throughout Yakima County, there continues to be vaccination opportunities. While the community vaccination center closed, we now have those mobile units that are going throughout the county. We'll keep a list of updated locations on our yakimavaccines.org page. And here I'm gonna go ahead and take a moment to share my screen so individuals can see where to access that. Okay, perfect. Can you see my screen? Thank you. Alrighty, so here we'll on our yakimavaccines.org, you can just go ahead and go on to that URL, and there we'll have a list of all the mobile locations that are occurring throughout the county. Today we did have some earlier, and it looks like we have a later one from 1 to 7 at El Mirador. And then tomorrow there's still availability in Fiesta Foods, and we'll continue to update this page with future dates as well. These locations are open to anyone 12 years and older, and they're free. No appointment is required. We're making it as low barrier and accessible to the community to come get vaccinated. And additionally, I also did want to mention that we still have our State Fair Park testing site at the Yakima State Fair Park. That one is open. It'll be open, have temporary hours, so it'll be open from August tomorrow, let's say August 11th, it'll be open from 8 a.m. to 2. August 12th, it will be closed due to an event occurring at the State Fair Park. Then on August 13th through the 14th, it'll be open from 8 a.m. to 2 p.m. So this is just one location that we have here. There's additional locations as well as locations in the lower valley. And individuals can also call 211 for a testing location near you. So those are just some opportunities that we do have for testing. If you do experience COVID-19 symptoms, regardless of vaccination status, it's important that you get tested. There, the State Fair Park is a good location, or individuals, a reminder, can call the 211 number. Perfect. And I'm just going to take a moment to check our Facebook to see if we have any comments from those individuals that are watching or any questions. Give me one moment. Alrighty, so first we'll be hearing from Dr. Yasmin. Thank you, Dr. Yasmin Barrios, for being here and providing us with all this valuable information. So today it looks like we reported 113 new cases of COVID-19 in Yakima County and 0 new hospitalizations. So we're going to go ahead and share a few graphs of case rates and hospitalization rates. And maybe Dr. Yasmin, you can begin with talking to us more about what trends we're seeing in terms of these cases and hospitalizations. And let me pull up my screen here.
Thank you, Stephanie. So yes, in our county, as we're seeing across the rest of the country, we're seeing an increase, a fairly quick increase in the case numbers. This is in part due to 2 things. Obviously, the Delta variant has been sort of taking over our alpha variant that was the primary cause of the infections. And as the Delta variant is considerably more infectious and a little bit more aggressive in terms of spreading, it has overpowered, kind of won out the battle between the variants, and now it is actually taken over. So with the variant, the increase in the Delta variant, we are seeing this rise in cases. Additionally, as you all know, our state changed mandates or requirements by opening up on June 30th, I believe. And so with that came a lot of freedom or a lot of behavior changes in terms of less strict masking in indoor spaces, and perhaps a little bit loosening of, gatherings, getting in touch with more people you haven't seen over the pandemic. And those two things combined, we've seen a lot of cases, and they have primarily been in unvaccinated individuals. We're, fully aware that viruses like to seek out vulnerable individuals and vulnerable groups of people. And so the unvaccinated population at the moment is a big driver of the spread. But, not only that, we are seeing with the Delta variant a little bit greater increase in breakthrough cases. We're finding that people who are vaccinated are now able to also spread the virus. So there's a lot of things going on, and you can't really identify just the one reason that we're seeing the increase. But the story is that we were seeing a decrease, and it was really a hopeful time at the end of May, June. But we're really being faced now with an increase and potentially a higher peak as we head into this fourth wave for some areas of the country, and for some, the third wave. Do you have another question?
Thank you, Dr. Yasmin. Did we want to go over the hospitalization graph as well, just to show the individuals watching? Okay, thank you.
Yeah, that would be really great. So our hospitalizations have also been increasing. Again, this is a trend that we're seeing across the country, and especially in areas where the vaccination rate is fairly low. Places that haven't made it past 50% are really seeing just a rapid spread. With the Delta variant, it's a little more severe. It may cause more severe illness. It may cause it quicker. So there's a lot of, like I said, there's quite a few different things at play here that have caused our hospitalizations to increase. We were seeing, rates of 2.7 per 100,000 in June, and this was, leveling out. We were essentially at a sort of plateau. We were thinking hopefully that we would just be able to ride that out as we continue to vaccinate. But with the introduction of the Delta variant, makes people potentially more ill and potentially more quickly. So these are the individuals that are ending up in the hospital. And our hospitalization rates are, you do have to keep in mind, they are the most sick individuals, the individuals who perhaps have underlying health conditions. But we're also seeing an increase in individuals that don't necessarily have those huge red flags for underlying health conditions. Early on in the pandemic, we knew that vulnerable age groups and vulnerable populations with those underlying health conditions were the ones that were ending up in the hospital. But now we're seeing healthier people we wouldn't have expected. It is trending towards a younger age group, like really affecting the 29 to 30, like the 29 to 39, the 40 to 50 age groups. And another reason, aside from the Delta variant, is that they're unvaccinated. We've had a huge success across the country, and also seemingly here in the Valley, in vaccinating our older age groups. They were the first eligible to get the vaccine, and it was very important because they were the ones really ending up in the hospital and the ones we were losing to death. And now it's shifted in part due to this Delta variant being, like I mentioned, a little more aggressive, but also because we have fewer individuals vaccinated in those younger age groups. So the hospitalization tells us that we have sicker individuals in the county. We have community spread. And this is what's really concerning with our relaxation of masking requirements, or even just like the behavior when you're in places where other people are wearing masks, you're more likely to wear a mask. So just the relaxation of that behavior. People are very tired from having to be, on guard for the last, 18 months. However, I don't even know how long it's been going on anymore. It feels like forever, but it is weary to be on guard all the time. So we need to sort of reevaluate and think about the risk that you have when you're going into different areas. Like, are you masking up in the grocery store? Are you masking up where you don't know other people's vaccination status? So all of these things are important to do, but our hospitalization rate, our case rate, they tell us that there's an incredible amount of community spread. And community spread means that it's sort of just everywhere. Like, you can sort of assume that across, the individuals that you'll see at a grocery store, that there's some percentage of them that will potentially be infectious with COVID. And we have a high, sort of a high proportion of the Delta variant being sequenced in Washington State. So we can also make the assumption that the Delta variant is widespread here in the Yakima County.
Alrighty, thank you, Dr. Yazin Barrios, for providing us that information and explaining more about the trends that we're seeing here in Yakima County, our case rate and hospitalization rate. Looks like we do have quite a few questions from the public here on our Facebook, those of them that are watching. So I'm just going to go ahead and list them out. So the first one that we do have a question on is, maybe Melissa, you could also help with this one. Is it safe and the right thing to bring kids back to school with the numbers going up?
So that's something that the state will be watching, a decision that we made with the Department of Health and likely the governor as well. I can tell you that when our case rates were this high during the last school year, we were not in person. So we definitely found that this was a high transmission and didn't feel kids should be back in school at that time. But we also know that there's mental health effects by not getting kids back to school, behavioral issues. These kids have lost out on a lot. So there's definitely a balance between risk versus benefits on going back to school. And that's something that the state will also focus on. We do know that our kids under 12 have not had the opportunity to get vaccinated yet. It's just another reason why, to get us back to normal, why anyone that can get vaccinated should get vaccinated to help protect those that are unable to.
Perfect. Thank you, Melissa. And then we do have another question from a community member. They asked, will the Yakima Health District ever recommend ivermectin for COVID-19?
Per the NIH, at this time, there's not sufficient evidence to say one way for or against the ivermectin. So at this point, until that evidence came out, enough research was done, then we wouldn't come out with that recommendation.
Thank you, Melissa. Alrighty, and then I think that's the questions for now, and we're going to jump over to you. So thank you, Melissa, for being here and providing us more information. There were some updates on masking changes that the CDC recommended. Can you talk to us a little bit more about what this new masking recommendations are and why these changed?
Sure. So the CDC recognized that there was a huge surge that had happened. And in response to that, with knowing that the Delta variant is much more contagious than the other variants that are out there. They made the decision to recommend masking indoors regardless of vaccination status in order to help prevent further spread of the disease. It was just another one of our mechanisms we could use to help prevent spread.
Thank you. That's why it's important definitely to follow those public health recommendations. Get vaccinated for COVID-19 as soon as possible. Anyone 12 years and older is eligible. All community members should wear a mask when you're in indoor public settings, and also for unvaccinated individuals, it's important that you also wear a mask when you're in crowded outdoor settings. And please continue to wash your hands frequently, sanitize surfaces frequently, and stay home if you are sick. And if you do develop COVID-19 symptoms, regardless of vaccination status, please get tested. And again, you can visit the State Fair Park or call 211 for a location near you. Alrighty, and it looks like we do have one question on the variant. Why is the variant more severe?
We know that viruses constantly change. New variants are expected to occur, and the longer the virus is around, the smarter it gets every time it replicates. And it's found that we've ways to deal. It just learns every time that it goes, and so that's it usually evolves into a stronger and more infectious virus.
Thank you. And that's why it's important, the more data we learn from it, the more we're able to adapt and also set those new recommendations, such as the masking, the more we are able to learn about the virus. Alrighty, so I'm going to check again on our Facebook to see if we have any additional comments at the moment. If not, we'll just continue on with our update here. So give me one moment while I Okay, perfect. So it doesn't look like we have any at the moment. So we can go on. I know a lot of individuals do have a question. If they already got COVID-19 in the past, is it still important to get vaccinated, or what is the terms on that?
And so it is still recommended that you get vaccinated. Experts don't know how long natural immunity gives you. So for somebody who's been infected with COVID-19, we just don't have enough research to say that it gives you lifetime immunity after. So it is still recommended, and as well as it also will give you a boost of protection. So if you get the vaccine, if you've had COVID-19 before and you get the vaccine, it just gives you that additional boost.
Thank you. And we did have a question that was left on our social media post about how many children under 18 have ever been diagnosed with COVID-19. Are we able to cover that data as well?
Dr. Barrios, I believe you have the answer for the kids that how many kids have been diagnosed in the county. Oh, I've got it here, 5,873. And that information is actually up on our website as well. Those are kids from 0 to 19.
Thank you, Melissa. And yes, we do have all that information on our data summary page on our Yakima Health District website. So once this update is over, I will go ahead and link that for everyone to see. And there we update all our new cases, new hospitalizations, our case rate, hospitalization rate, and all that information too. Perfect. So I'm going to check again on our Facebook. I know we're almost out of time. We will have our Spanish update at 6:30. Okay, perfect. So I think that's all the questions that we have for the moment. Is there any other information that you would like to provide before we end our update? Any of you two?
I would just like to add that, we have had breakthrough cases here in Yakima County, across the state, nationwide, worldwide, and we do watch those. And when we look at the amount of people who have been vaccinated compared to the amount of breakthrough cases we have had, it is a very, very, very low percentage. This is a very effective vaccine. It has done what it was intended to do. So it's preventing people from getting COVID. But even with this new variant that is not as effective towards, still very effective, but not as effective, it is preventing death and hospitalizations. In over the last month, we have had 79 people hospitalized that are Yakima County residents, and only one of them was unvaccinated. And in the last 2 weeks, we've had 46 people hospitalized, 42 residents hospitalized that are Yakima County residents, and none of them were vaccinated. So it just shows the vaccine is working. It's very safe. If you have questions, ask your doctor. If you feel uncomfortable, they can answer any questions you have to give you some reassurance. But this vaccine is doing what it was intended to do. Very effective.
Yeah, I just wanted to second that. I think it's also very important to understand a little bit of the history of the vaccine, just to know that while it was developed very quickly in terms of the timeline, none of the science was actually compromised. I think a lot of people may not know that, the way clinical trials are done, they got rid of a lot of the red tape. Scientists working on developing the vaccine did a lot of work in parallel to make sure that they understood, the vaccine that they were developing. And there was no shortcuts in the process that every drug that gets approved by the FDA goes through. So I think a lot of things that I've been hearing have been people's hesitancy of why it was developed so quickly or how it was developed so quickly. And just that it's a very interesting history. The science has been, they've been working on that for decades, and scientists worked really well together, and Operation Warp Speed really removed a lot of the red tape. So I think that's really an interesting thing, and really just speaks to the collaboration of the scientists to develop the vaccine for it to be safe for us to use.
Not to mention the funding. A lot of vaccines and new medicines are held up due to funding. And because this was a worldwide pandemic, many resources were put into this, which also allowed for the expedition of having this vaccine available.
Yes. And I think also, some of the questions that I've gotten have been about, side effects or causes of deaths that people think have been caused by the vaccine. In epidemiology, we look at causal relationships, and oftentimes just because something happens in a specific order, people tend to attribute that to the thing that they knew before. So really important to dispel some of the rumors that if someone passed away and it happened months or weeks after they had a vaccine, to date, there has been no causal linkages between the vaccinations and any deaths. That is potentially just a random occurrence. So trying to, make sense of what's going on, people can attribute causal relationships to things that aren't. And I think it's important to note that for vaccinations, we have not found any causal relationship with death and the vaccine.
I think it's good to keep it in perspective as well as, it feels like there's a lot of people having side effects or bad outcomes from this vaccine. We're talking about millions and millions of people being vaccinated versus over a course of time, people getting their childhood vaccinations. So it seems like there's a lot of side effects that are being reported, but in reality, it's minimal. And, if you have a headache or a fever or you're tired after your vaccine, it didn't make you sick. It was your immune system responding, which is great. That's what you wanted to.
Yeah.
Alrighty, well, thank you so much, because I know those are concerns that the communities do have, and questions that a lot of them come up recently too. So it's definitely important to be able to address those. So hopefully for those that are watching, if you still have any more questions, I know we're going to end our update here. Please feel free to continue to leave those in the comment section. We'll continue to revisit this video on our Facebook page and address those questions. And if we didn't get to your question, we'll again address it at a later time. and get your questions answered, but please feel free to continue leaving those on there. So thank you again, Dr. Yazan Barrios and Melissa, for being here and providing us all this information, answering any concerns that the community may have, as well as any questions about the vaccine too. Gracias a todos por acompañarnos hoy. Sé que ya son las 6:30, ya va a empezar la actualización de COVID-19 en español aquí en unos minutitos. Esperemos verlos ahí. Ahí va a estar la doctora Barrios, va a estar también la doctora Consuelo Rodríguez y también va a estar Jocelyn dándoles toda esta información sobre nuestra actualización. Thank you again, you two, for being able to provide us with this information, and we will see you next time.
Thanks, Stephanie.